The pelvic girdle is how our lower appendages, our legs, attach to our body. So the pelvic girdle is made up of the sacrum, which is part of our vertebral column, and then our two coxal bones, which is our left and right hip bone. Sometimes the coxal bone is also called the os coxae, or the innominate bone. So if you're studying and you see any of those terms, they all mean the same thing. That's this bone right here. And this bone is made from a merging of 3 different bones. So we have 3 different regions on here. The ilium, which is this top yellow portion, the pubis, which is over here in pink, and then the ischium, which is over here on green. So this would be the anterior portion of the body, so the pubis is where your hip comes together in the front, and then the ischium is posterior, right? So this ischial tuberosity is this large portion here that you sit on in your chair right now while you're listening to me. The acetabulum right here is our hip joint. So this is this large socket where the femur comes in. Acetabulum, one of my favorite words. And it's actually where all 3 of these bones merge. You can see this spot right here. The ilium has this large iliac crest. So if you reach down and feel the top of your hips, that's this large iliac crest that you're touching. The hip girdles in a male versus a female skeleton are sexually dimorphic, meaning that they look different in the 2 sexes. So typically males are going to have taller, more narrow hips, so they have kind of a narrow arch right here, whereas in the female it's much wider. The iliac crest up here is taller in the male, whereas in the female it's only about that tall. The same thing for the pubic symphysis. So in the male, the pubic symphysis is almost twice as tall as this female. The sacrum itself is narrow, so this is a narrow opening here, whereas in the female it's much wider. And the reason for that is because this is the birth canal, right? This is the smallest opening that the baby has to get through when it's being born. And so because this needs to be larger in women who bear children, it tends to be wider and as a result a little bit shorter. Male hips tend to be more narrow and then as a result a little bit taller. In our leg lower appendage we have again 3 regions, just like the arm. The first region is our thigh, which is made up of the femur and patella. Beneath that we have our leg, which is also called the crural region, which is going to be made of the tibia and the fibula. It's important not to mix up these suffixes. So there is no tibula and there is no fibia. Beneath that we have the foot, which is going to be made up of the tarsals, which make up our ankle and heel, the metatarsals, which make up kind of the flat portion of our foot, and then the phalanges, again, which are the toes. So in the femur, we've got this large head that's going to insert into the acetabulum at the hip joint. The neck of the femur is going to be right beneath the head, and this is where it necks into its narrowest place. So in somebody who breaks their hip, usually that break is going to happen right here at the neck. We have 2 trochanters here, this greater trochanter and this lesser trochanter, and these are going to attach to our large gluteal muscle, which is what pulls the bone out. Down on this end we have our articular surface, so there's a flat patellar surface here that's going to articulate with the patella, and then the medial and lateral condyles here are going to articulate with the tibia in the leg. The patella, or the kneecap, is this triangular sesamoid bone, so this actually forms inside of the tibia tendon. So we have the femur, which attaches to the tibia and the fibula, and then here we've got our patella here on the kneecap. And this is functionally important because what it does is it extends this tendon before it attaches to the tibia, and it actually provides a greater angle for force to pull on that lower portion of the leg. The patella doesn't actually ossify until about 3 to 6 years old. Inside the leg, we have two bones. The tibia is this large bone, and then the fibula is the smaller bone on the side. The only bone that actually gets any force of the body is this large tibia. So this is going to articulate with the femur right here. The fibula does not receive any force of the body, so this is actually not under any tension. So this is a common choice for bone grafts because it's not actually even holding you up. We see another interosseous membrane. So it is useful because the tibia can extend some of the force that it receives onto the fibula. Down at the bottom of each of these, we have a malleolus. So if you reach down and touch the inside, so medial is inside of your ankle, you're touching this large knob called the medial malleolus. And then on the outside of your ankle, so if you reach down and touch the large knob on the outside of the ankle, that's going to be the lateral malleolus of the fibula. And the tibia here is going to articulate with the foot. So in the foot, we again have the tarsals, which we can see in two rows. There's the proximal row here, and then the distal row here. And these aren't quite as conveniently named. In the proximal row, we have the talus. And if you look at this lateral view, the talus is fairly tall. So that's how I remember the talus. The talus is tall. The calcaneus is this large one on the bottom. So if you touch your heel, you're actually touching the calcaneus. And then the navicular. So I like to remember the navicular with these three cuneiforms here. So in the distal row, we have this large square one on the outside of the foot called the cuboid. And then next to that, we have three cuneiforms. We have the medial cuneiform. So medial is towards the inside, so that would be towards the arch of your foot. Intermediate is in the middle, and then lateral being towards the outside. So I like to think of these as the three C's. And then the navicular to me sounds like the navy. So we've got the navy, which is a boat. Right? It's my boat. And it's floating on the three C's. And I think of that as like C's. So it's a play on words. So that's how I remember these ones, is this is the navicular, and it floats on the three C's, the cuneiforms. Past that, we have the 5 metatarsals. And these have the same numbering schema as the hand. So once you've learned the hand, the rest of this foot is actually really easy because the phalanges have the exact same names as they do in the hand. We have 1, which is the thumb, which is your big toe, and then 5 is going to be the pinky toe, just like 5 is your pinky finger. And everything except for the big toe has a distal, a middle, and a proximal phalange. They're just very small. And then the big toe has just the distal and the proximal. So take a moment and compare and contrast between a typical biological male and female coxal bone.